Dr. Kaseti, if I may call you that, how long
Yes.
have you been minister in Ethiopia now? 5 years?
Yeah, 2 years as a deputy, 3 years as a minister, 5 years.
My goodness me. So you're deeply entrenched in the organization of health. I think it was 3 years ago that you participated first in the Harvard program, Ministerial Leadership in Health program. I wanted to ask you, was there anything about what you experienced 3 years ago that has been useful to you in your term as minister?
Yeah, well, when I joined the Harvard ministerial program, I was very new into the job, although I have been a deputy minister for 2 years prior to that. But it got me to think about, what would be the things that I want to really be remembered about after I finished my term. So it really got me to think the top priorities that I want, the country to implement, the health sector to implement. And it really gives me the opportunity to focus more on, emphasize on implementation and delivering the priorities that I think would really bring about a transformational change in the health sector. So it really coincided with a new big initiative that we launched in the health sector, which we call the Health Development Army. And I identified it as a top priority that needs to be implemented, in all the regions across the country and so on. So when I took the course, I had, this big project in mind already laid out in the country, and the course has helped me to refine some of the approach and the things that we need to put in place to improve the performance.
You've also set up a ministerial development delivery unit.
Yes.
in the ministry, right?
Yes.
What is that? How does that work?
Yeah. In fact, during my stay here, the course that really get me excited was the minister's delivery unit. I mean, the concept of setting up a delivery unit. Sir Michael Barber, shared us his experience while he was working with Prime Minister Tony Blair at the time and in his delivery unit. And I thought that was very interesting because as ministers, we are always, taken up by surprises, shocks happening everywhere, lots of unplanned, meetings, events, launches, and so on happening, across the world and across the country as well. So if you really want to implement big projects, initiatives that you deeply care about, you need a mechanism to stay on top of those projects, to make sure that those projects are successfully implemented. And as a minister, you play a facilitative role to make sure that those things are get done. So as soon as I went back, to Addis, I set up this minister's delivery unit in my office, and chief of staff of the ministry was the head of this minister's delivery unit, and we pulled in some people from different departments. And
So these were all people in the ministry. You didn't go outside of the ministry.
all of them were in the ministry. Some of them working in the different departments, some were working in my office. So we have designed their roles and the responsibilities, and their primary responsibility was to follow up on priorities that we have identified. So we identified around 9 initiatives that needs to be implemented, during my term. Some of them had a target, ambitious target to be implemented within a year. Some, an ongoing process, but with clear milestones that needs to be implemented every year. So the minister's delivery unit, once, they are clear and they were supported by, the Harvard team, they had a clearer idea. They started to work with the different departments, helped them to refine their plans, and to make sure that, I will keep an eye on, what is going on. And they developed, these monthly reports they generate that, they present it to me, and I also have a stock take meeting with the relevant departments, with all the actors involved in the meeting. So
has it accelerated progress? You think it would everything have happened even if there hadn't been a delivery unit, or has the delivery unit really been the difference?
the delivery unit has been very helpful. Because as I said, there are lots of distractions in a minister's
Sure.
daily schedule. So having a minister's delivery unit really helped me refocus, make sure that I still have an eye on those priorities that I have identified.
What about those outside of the delivery unit in the rest of the ministry? Are they kind of suspicious of the delivery unit that, this is the minister's spy?
Yes, in the beginning, yes, that was the feeling. There was uneasiness about, what the minister's delivery unit are going to do. They considered them as, individuals that are going to take away their jobs, their responsibilities, and so on. So there was really uneasiness in the beginning, despite the reassurance, the discussions that we had in the beginning. But as time goes on, and as they see that the minister's delivery unit plays a facilitative role, I also play a facilitative role to make sure that things are done. They started to use it, and in fact now some of them, even want to see me before the stock take schedule, so that we could really solve some of the problems. But the minister's delivery unit are also facilitating that.
Given what you know now, um, would you have started out differently when you became minister?
Well, I my what I would have loved to do was, when we developed our sector-wide plan, if we had, an extensive details on some of the things, how, they are going to be implemented, how they are going to be translated into practice, and so on, would have accelerated the implementation that we have done. So we started to do that for new projects. We started this year, for instance. Now we introduced what we call these flagship projects. So every department in the ministry and every agency that is accountable to the Ministry of Health has to come up with only one priority, top priority, which they consider as flagship projects. These flagship projects are projects that are, very important for the sector, that has not really been successfully implemented. And if successfully implemented, they have to bring, significant change to the way services delivered and services taken up. So for these flagship projects, we have what Idris Jala calls a 3-feet, detailed implementation plan. Who is responsible, what, when, what are the milestones that show that there is progress towards that, and so on. So I think had we started that long before, we would have done, much better than we did. But overall, the progress is good. So yeah.
So you're happy, and your
Yes.
Prime Minister is happy, I'm sure.
Yes, I hope he is.
Thank you, Dr.
Thank
Kesetebirhan.
you
A
very
great
much.
pleasure.
Yeah.